Most strokes do not announce themselves with a sudden burst of pain. They arrive without fanfare, often in the dead of night, while the person is fast asleep and entirely oblivious that their circulation is quietly faltering due to an unsuspecting posture. At this very moment, countless individuals over the age of 60 are drifting off in a position that gently elevates pressure on the heart, worsens the natural drops in oxygen that occur during sleep, and may subtly encourage the formation of dangerous blood clots, hour after relentless hour. What makes this truly chilling is the fact that the human body frequently sends out warning signals long before a full-blown crisis erupts, yet nearly everyone fails to decode these messages in time. If you are genuinely committed to elevating your health and well-being, I warmly invite you to hit that subscribe button. My mission is to share straightforward, actionable advice, tailored specifically for seniors, and I would be delighted if you left a comment letting me know where in the world you are joining me from. I sincerely appreciate each and every one of you. Now let us dive back into the heart of the matter. Nobody ever brings up 3 a.m. Not your family physician, not the cardiologist who meticulously reviewed your most recent scan, not the evening news anchor delivering a segment on heart wellness. The entire conversation revolves around what you do during your waking hours. The meals you choose, the pill bottles on your nightstand, the morning stroll you either commit to or continue to put off. Yet there exists a specific sliver of time, a window your doctor has almost certainly never questioned you about. It is during this interval that the cardiovascular system of an adult past 60 becomes quietly, measurably susceptible. And it unfolds while you are sound asleep, while the room is shrouded in darkness, while the house is wrapped in silence, while every person who holds you dear assumes you are perfectly safe simply because you are at rest. Here is the common misconception most people hold about sleep. They believe the heart is recuperating, the body is undergoing repair. They assume nothing perilous can possibly occur while they are lying motionless with their eyelids shut. However, research featured in the journal Circulation paints a markedly different picture. The risk of stroke and sudden cardiac events reaches its zenith during the early morning hours, not during physical exertion, not during moments of stress, but during the hours immediately surrounding sleep. The body is at a standstill, yet the danger is not. Because while you remain inert for 7 or 8 consecutive hours, your blood pressure undergoes dramatic fluctuations. Your circulation decelerates. Fluid that has accumulated in your lower limbs throughout the daytime begins its journey upward toward your chest. Your breathing patterns shift in ways that go largely unnoticed, and your heart, which possesses no off switch, must navigate through all of this while maintaining a position it never voluntarily selected. For adults over 60, this reality carries far more weight than most are ever informed about, for the simple reason that the cardiovascular system at 65 is not the same machinery it was at 45. Blood vessels gradually shed their elasticity. The inner lining of the arteries becomes less proficient at regulating the flow of blood. Nitric oxide production, that crucial compound responsible for keeping arteries relaxed and open, experiences a marked decline with advancing years. Gravity begins to assert its dominance, and for 6 to 8 hours every single night, it pulls against a circulatory system that is already laboring harder than it should. The warning signs are deceptively easy to overlook or brush aside. Feet that appear puffy before you have even eaten breakfast. Legs that feel inexplicably heavy and dense upon waking. Nighttime palpitations that flutter in and out of existence. Exhaustion that refuses to budge despite a full 7 hours of sleep. More trips to the bathroom at 2 a.m. than you can logically account for. The vast majority of people do precisely what I would have done myself in their shoes. They chalk it up to the natural aging process. They mention it in passing to their doctor, receive reassurance that their numbers are within acceptable limits, and return home. They lie down in the very same position they have occupied for decades. My name is Dr. Alan Mandell, For nearly 2 decades, I have dedicated my professional life to working with older adults, grappling with cardiovascular disease, blood pressure instability, circulatory disorders, and the long road of stroke recovery. Over those years, I began to observe a recurring pattern among my patients that I could no longer rationalize away, a pattern that kept directing my attention back to the same location, the bedroom. More specifically, it pointed to what was occurring during those silent hours when no one was keeping watch. And what I uncovered genuinely revolutionized the way I perceive cardiovascular health after the age of 60. Gravity. That solitary word is where this discussion must commence, because when most individuals contemplate what threatens their heart, their minds gravitate toward cholesterol, stress, hereditary predispositions, sedentary routines. Nobody spares a thought for gravity. Yet after 60, gravity emerges as one of the most relentless forces actively undermining your circulation. And nowhere does its impact resonate more profoundly than during the hours you spend reclining horizontally. Here is what shifts internally within the aging cardiovascular system, a reality most physicians never find the time to elucidate during a compressed 15-minute consultation. Your veins carry out a responsibility that most people drastically underestimate. They do not merely transport blood, they actively propel it upward from your feet, your calves, your thighs, all the way back to your heart, working against the pull of gravity every single minute of every single day. At 35, the walls of your veins possess enough muscular tone and elasticity to execute that function with admirable efficiency. At 65, that efficiency has quietly eroded. Studies published in the Journal of the American College of Cardiology have demonstrated that vascular stiffness escalates progressively with age, diminishing the cardiovascular system's capacity to adapt to fluctuations in pressure, including the pressure shifts that occur unfailingly every night during sleep. Then there is the endothelium. The endothelium is that delicate inner lining of your blood vessels. It shoulders the responsibility of releasing nitric oxide, a signaling molecule that instructs arteries to relax, dilate, and sustain smooth, healthy blood flow. After 60, nitric oxide production drops off significantly. What this translates to in practical terms is this. Arteries that once unfurled effortlessly under mild demand now respond more sluggishly, more completely, and with considerably more exertion. Blood travels differently, pressure accumulates differently, and when circulation slows, as it invariably does during sleep, the likelihood of blood pooling in the lower extremities increases in ways that simply did not exist when you were younger. This is one of the primary reasons deep vein thrombosis, the formation of dangerous clots in the leg veins, becomes substantially more prevalent after age 60. The CDC estimates that blood clots affect anywhere from 300,000 to 600,000 Americans annually, with the risk climbing sharply in older adults. Yet the vast majority of people never draw a connection between that risk and the hours they spend lying motionless. They associate it with long-haul flights, with hospital stays, with surgical procedures, never with their own mattress. Now introduce one additional layer that exacerbates the situation. Throughout the day, fluid gradually pools in the lower legs as a result of gravity and diminished venous return. By evening, many adults over 60 are carrying a measurable surplus of fluid in their ankles and calves without any conscious awareness. When they lie flat at night, that fluid does not remain confined to the legs. It redistributes upward, migrating toward the chest, the airway, the spaces enveloping the heart. And this redistribution, unfolding silently while you sleep, can contribute to nighttime breathlessness, elevated blood pressure, fragmented sleep, and unexplained lethargy the following morning. Most people attribute it to a poor night's rest, but their body was reacting to something mechanical, something that occurs every night, something that varies significantly, depending on one variable, almost nobody takes into account the position the body adopts while it slumbers. So the question now becomes unavoidable. If the aging cardiovascular system is already operating under increased strain, if veins are less efficient, arteries are stiffer, and fluid is shifting toward the chest every single night, then what happens when the resting position of the body exacerbates all of that? The answer is something most people have never once contemplated, because for the overwhelming majority of adults over 60, their sleep position was established decades ago, not by a cardiologist, not by anyone with a grasp of vascular mechanics. It was dictated by habit, by comfort, by whatever felt natural at 28 years old, and it was simply never revisited, and the body has been quietly paying that price ever since. Let us begin with the most prevalent position among older adults, lying flat on the back. It feels logical. It feels neutral. It feels as though the body is evenly supported with no undue pressure favoring one side. But for adults over 60 with any degree of vascular alteration, back sleeping carries a consequence that most people never see coming. When the body reclines completely flat and the spine is aligned horizontally, the tongue and the soft tissues of the throat relax backward under the influence of gravity. In younger adults with robust airway muscle tone, this causes minimal disruption. In older adults, it can partially and sometimes significantly obstruct the airway. The result is sleep apnea, and sleep apnea is not merely loud snoring. Research published in the Journal of the American Heart Association has firmly established a direct link between untreated sleep apnea and an elevated risk of hypertension, atrial fibrillation, stroke, and heart failure. Every apnea episode drives oxygen levels in the blood downward. Every drop in oxygen triggers a stress response. The heart rate surges, blood pressure spikes, and this cascade can unfold dozens of times per night without the person ever fully waking, without them ever having a clue. They arise in the morning feeling unrefreshed, foggy, and heavy, and they assume they simply slept poorly. But their cardiovascular system absorbed hours of repeated stress while they lay completely unaware. Now consider stomach sleeping. This position compresses the chest cavity directly. It forces the neck into a sustained rotation for hours at a time. It restricts the natural expansion of the lungs and places mechanical pressure on the diaphragm, that primary muscle responsible for breathing. For an older adult with any degree of cardiovascular compromise, restricted breathing during sleep is not a minor inconvenience. It is a nightly levy on the heart. Then there is right-side sleeping. This one receives less attention, and the scientific evidence here is more nuanced. So, I want to be careful not to overstate it, but anatomically, several cardiovascular structures are oriented in ways that may be influenced by sustained pressure on the right side of the body. Some patients with heart failure report increased discomfort when sleeping on their right side. Some research suggests right-side sleeping may impose different mechanical demands on the inferior vena cava, that large vein responsible for returning blood from the lower body to the heart. It is not a dramatic effect for everyone, but for someone whose circulation is already compromised by age and vascular stiffness, spending hours in a position that adds even modest additional resistance to venous return is not a neutral decision. I had a patient, a 71-year-old retired civil engineer named Henry, a meticulous man who monitored his blood pressure twice daily, took his medications without fail, walked 30 minutes every morning regardless of weather, and yet every night he woke between 2 and 3 a.m. with his heart pounding and his chest feeling strangely dense. Cardiac workup after cardiac workup returned unremarkable results. When I finally asked him to describe precisely how he slept, his position, his pillow height, his body angle, the picture began to shift. Henry had slept flat on his back his entire adult life, and he snored heavily enough that his wife had relocated to a separate room 11 years earlier. That detail alone told me something important. Within 6 weeks of altering his sleep position and angle, Henry's nighttime awakenings had diminished dramatically. His morning blood pressure readings were more consistent, and for the first time in years, he described waking up feeling as though sleep had actually done something for him, not magic, mechanics. And that brings us to the position that kept surfacing among my patients who were quietly improving, the one I could no longer overlook. I want to be candid with you about something. When I first began connecting these dots, I resisted the conclusion because it felt too simplistic. In medicine, we are conditioned to seek complex answers for complex problems. We investigate, we order tests, we adjust medications, we refer to specialists, we construct treatment plans with numerous moving components. The notion that something as elementary as which side of the body a person sleeps on could meaningfully influence cardiovascular strain. It felt almost too straightforward to take seriously. But the pattern kept emerging patient after patient, year after year, and at some point, the evidence accumulating in front of me became impossible to keep dismissing. Here is what I started noticing across a significant number of my older patients who were quietly improving. Not dramatically, not overnight, but steadily and consistently, without any major alterations to their medications or lifestyle. They were sleeping on their left side. Not all of them had made that choice deliberately. Several had shifted there naturally due to discomfort in other positions. A few had done it on the advice of a physical therapist treating an unrelated issue. One patient, a 69-year-old woman named Ruth, told me she had started sleeping that way simply because her bedroom furniture had been rearranged. She had no idea it was affecting her heart, but her nighttime palpitations had decreased. Her morning ankle swelling was noticeably reduced. She was waking less frequently during the night, and her early morning blood pressure readings, historically her most unstable, had become more consistent over a period of several weeks. Now, here is the anatomy that makes this more than mere coincidence. The heart sits slightly left of center in the chest cavity. When the body lies on the left side, the heart is not being compressed against surrounding structures in the same way it can be under other positional pressures. Beyond that, the thoracic duct, the body's primary lymphatic drainage channel, responsible for returning fluid and metabolic waste from the lower body back into circulation, empties predominantly on the left side of the chest, near the subclavian vein. Left side positioning appears to support that drainage pathway rather than obstruct it. Additionally, research involving patients with congestive heart failure, published in the American Journal of Cardiology, has demonstrated that body position during sleep measurably influences autonomic nervous system activity, the system that regulates heart rate, blood pressure, and vascular tone during rest. Position is not passive. It is an active cardiovascular variable operating every single night. Now, I want to be direct with you because I have no interest in overpromising. Left side sleeping is not a cure. It does not replace medication. It does not reverse arterial disease or eliminate stroke risk on its own. But as a mechanical adjustment, one that costs nothing, requires no prescription, and takes effect the moment you close your eyes, it may be one of the most underutilized tools available to adults over 60. And it is only the first part of what I want to share with you, because position alone does not constitute the complete picture. There is something else. Something most people get dangerously wrong every single night without realizing it, and it has everything to do with angle. Angle. That solitary word is what separates people who sleep correctly for their cardiovascular system from people who think they are but are not. Because here is what occurs in almost every bedroom across the country. An older adult hears that elevating during sleep is beneficial. Maybe their doctor mentioned it casually. Maybe they read it somewhere, so they do what feels logical. They stack pillows, 2 pillows, sometimes 3, occasionally 4, and they go to sleep believing they have solved the problem. They have not. Here is what stacked pillows actually do to the body. They push the head forward and tilt the chin downward toward the chest. The neck bends. The cervical spine curves unnaturally, and the torso, the chest, the heart, the lungs remains completely flat against the mattress. So, the head is elevated, but the cardiovascular system is not. The very structures that need positional support, the heart, the major vessels, the lungs, are still lying at the same flat angle they always were, and the neck is now under sustained mechanical strain for 7 hours on top of everything else. This distinction matters enormously, and almost nobody makes it. What the cardiovascular system actually benefits from is gentle upper body elevation, meaning the torso rises, not just the head, the chest, the shoulders, the upper abdomen, all inclined at a gradual upward angle. Research on nocturnal blood pressure patterns has shown that upper body elevation of approximately 15 to 20 degrees can support healthier nighttime blood pressure regulation. A study published in the Journal of Human Hypertension found that sleeping position and body angle measurably influence nocturnal blood pressure dipping, that natural overnight drop in blood pressure that protects the cardiovascular system during sleep. When that dipping pattern is disrupted, which flat sleeping in older adults frequently does, the heart absorbs hours of unnecessary pressure that compounds night after night. Gentle torso elevation helps restore that pattern. And there is a second reason elevation matters that most people never anticipate: the vagus nerve. The vagus nerve runs from the brainstem through the chest and into the abdomen. It regulates heart rate, digestion, and the body's parasympathetic rest and recovery response. The esophagus runs directly alongside it. When an older adult sleeps completely flat after an evening meal, stomach acid can move upward into the esophagus, a condition most people recognize simply as nighttime reflux. But what most people do not realize is that esophageal irritation can stimulate the vagus nerve directly, triggering sensations that feel alarmingly cardiac. Racing heart, chest tightness, sudden waking with a surge of anxiety that feels indistinguishable from a cardiac event. I had a patient named Arthur, 68 years old, retired secondary school teacher, came to me convinced something was seriously wrong with his heart because he woke in a panic at 3 a.m. several nights every week, chest pounding, certain he was in danger. 3 separate cardiac evaluations found nothing structurally wrong. What we found instead was that Arthur ate his largest meal of the day at 8 p.m. and went to bed completely flat less than 2 hours later. Once he shifted to a gentle upper body incline using a proper wedge support rather than stacked pillows, and adjusted his evening eating window, those nighttime episodes reduced to almost nothing within a month. His heart had not been the problem. His angle had. Now, the tool that makes genuine torso elevation possible is a wedge pillow, a firm, gradually inclined support that lifts the entire upper body as one continuous unit, rather than bending the neck forward in isolation. It is not expensive. It is not complicated. It does not require a prescription or a specialist referral. It requires understanding why flat is not neutral for an aging cardiovascular system, and understanding that position and angle together form the foundation of what I now consider a complete nighttime heart support approach. But there is still one more piece, one that almost no one discusses, one that I rarely hear raised in clinical settings, and one that once you understand it will completely change how you think about the hours before you go to bed. Here is something that will change how you look at your own legs tonight. Right now, as you are reading or watching this, fluid is pooling in your lower extremities. Not because something is wrong with you specifically, not because of a diagnosis or a deficiency, but because of gravity. Every hour spent upright, sitting, standing, walking, pulls fluid downward into the tissues of the lower legs and ankles.